Good morning, ladies and gentlemen. So allow me to step in for the Prime Minister, who unfortunately could not be present because he had to be present at some deliberations that are of utmost importance. It is a true pleasure for me to welcome you to the conference, and it's a true pleasure here if I look around to see faces that are very familiar. I've known many of you for years, and I'm really glad that this theme is gaining on importance in society at large. Today's conference focuses on novel approaches, novel mental health treatments, and we also need to debate sustainability of healthcare systems. This is a truly relevant topic, not just for the Czech Republic, but for the whole Europe. Last week, together with colleagues from our committee, we went to Israel, where we, among other things, we debated crisis management and also development of events that started to unfold on the 7th of October and the impact of all those events on the mental health of the population. But this is naturally an issue not only limited to Israel, but people really around the world. Many challenges are brought about that. Burden on the healthcare system due to the aging of population is on the increase. There is an increasing prevalence of various mental health problems, and this poses an increased pressure on the quality of care. We are struggling with also shortage of healthcare professionals, whether it's doctors and other related professions, and we all struggle with limited funding. Mental health problems are indeed becoming more and more serious and have an impact on the whole society. These are caused by various triggers, whether it's instability and further burdens. COVID-19 pandemic has been a great contributor, and also the war conflict in Europe, in the Middle East as well. Mental health in the past, and hopefully it's no longer the case, used to be overlooked, but it's an important part and parcel of the state of health of the population. And we therefore in this domain need to focus on prevention, early diagnosis, and if needed then efficient treatment of mental health disorders. Because these issues have a fundamental impact on whether the person can pursue their job and lead a quality life. In this domain, we need to focus not only on prevention, but also on improving access to care and improving quality of care. In the Czech Republic, this is actually impacted by a shortage of trained staff, whether it's psychologists, psychiatrists. And in the Czech Republic, what's especially relevant is child psychiatry. And this this that used to be on the sidelines a couple of years ago. We need to have the whole system set up to promote innovations, use of novel treatment methods. In the Chamber of Deputies at present, there is a piece of legislation being debated, the ambition of which is to set up the regulation for the use of active psychomodulating substances. And it's going to be an important topic also for the deliberations of our healthcare committee. In the area of mental health, the Czech Republic has a lot to offer. I've got many friends here in this hall who are top experts in psychiatry, and thanks to them, during the Czech Republic's presidency of the Council of the EU, mental health made its way to the top priority agendas. So really thanks to the contribution of experts from this field of healthcare, we managed to put that on the agenda, and we were praised for that by others. The Czech Republic has a unique model that combines mental health policies, novel approaches to the treatment of addictions, evidence-based approaches, and approaches that combine also approaches pursued in other fields of medicine. I must say that certain addictions have a negative impact on the mental health of individuals. The Czech Republic, however, offers a comprehensive approach to prevention, diagnosis and treatment. I'm truly pleased that I can also extend a warm welcome to our Ukrainian colleagues. Even though inviting them to this event was quite complicated, there are stringent criteria in place for our Ukrainian friends traveling abroad. So I'd like to thank the President of the Senate, Mr. Vystrčil, here for taking care of all that and making all the necessary arrangements. Thanks to his efforts, we can meet in person with our dear Ukrainian friends, and the chairman of the Healthcare Committee, Mr. Michal Radutsky, his counterpart, actually was able, thanks to that effort, to travel to Prague. We'll speak about the situation in Ukraine, which currently is facing extraordinary challenges, in the contributions to be made by colleagues, psychiatrists and other experts. Surely they will speak lots about that. Establishing structured cooperation may bring a significant improvement of the quality of life in Ukraine. I firmly believe that today's meeting will bring about new knowledge and specific steps, whether it's innovative therapies, psychiatry, and sustainability of the healthcare system, whether it's from the organizational, financial perspectives. And I do hope that we'll be able to further advance this topic and see further improvement in the debates related to the sustainability of healthcare systems. Thank you very much, and my apologies for reading my contribution. I also wanted to convey the greetings from the Prime Minister of the Czech Republic, Mr. Petr Fiala. Allow me to wish this conference every success.